Okay, I think that should be good.
Okay, great. Good morning, everyone. Early meeting of the Needham Board of Health. I'm Kathleen Brown, the chair. The meeting will be conducted by Zoom per the governor's order from March 12, 2020, related to the SARS-CoV-2 pandemic. Let's see, there will not be public comment. It's just mostly to get an update from staff on the COVID status. And I'll call your name and just respond in the affirmative that you're here, so we know you're here. Ed Cosgrove.
Here.
Christina Matthews.
Here.
I'll go around. Steve Epstein.
Here.
Rob Partridge.
Here.
Okay, great. Let's see, any other staff that, so Tim McDonald, you can just say.
Present.
Tara.
Here.
Tiffany.
Here.
Cynthia. Cindy.
Here. Good morning.
Hi, good morning. Sorry, Christina, I don't know you. If you want to announce yourself.
Yes, I'm Christine Barraford, and I am your recording secretary.
Great.
I wasn't able to join you the other day, but I am able to join you live today, and I'm happy to be part of this group. Certainly, it's the subject matter is rather poignant, but these are the times, and we all hope that they're changing soon.
Thank you. Welcome. Let's see. So I think we'll start with a COVID update. And I think we're beginning with public information campaign and community education.
Yes.
Okay.
Great. Well, thank you. Good morning again. I asked Tim when he asked me to come on and present to you all this morning what I had done to upset him. But here we are. So as you can probably imagine, we're sort of taking a multi-layered approach right now to messaging. Obviously, people are very focused on the vaccination and when and where they can get the vaccine. So over the last couple of weeks, that has been our primary messaging focus. However, at the same time, we still have issues that we've been dealing with since the beginning of COVID in terms of messaging. Most recently, as you probably know, and Tim may talk about later, the high school has seen an increasing number of cases among students and staff. And so we launched this week, which was timely because we've been working on it for a few weeks, a mask campaign, the Needham Mask Challenge, which I'll talk about as well. So I want to start by just giving you some information about what we've been doing on the vaccine front to educate the public. So a couple of weeks ago, when first responders became eligible, we made sure that, and Kathleen, you were there, that we let the community know that this was happening in part to address those who may be concerned about the safety of the vaccine. We wanted to show that our police and fire chiefs were getting the vaccine. All of our first responders were showing up. And so we had some really great local and Boston-based media coverage of that, which was terrific. In the last week or so, obviously the focus has shifted to, in particular, the 75 plus population who has recently become eligible under the state's phased approach. And so we have updated the town's COVID website so that vaccine information is at the very top of the website. There's a frequently asked questions link that we'll update today or tomorrow with some additional information. But then there's also the most immediate points for people. And again, that's at this point, it's being updated every day as information from the state is changing every day. We've also begun to employ more frequent updates through our COVID email list. We've seen a pretty sharp increase in the number of subscribers to that list. We're well over 1,500. We may even be close to 2,000 at this point. So we've been pushing out updates to the community through that email list, as well as the select board town manager email list as well. We've been updating on our social media, primarily on our Facebook. We tend as a town not to typically engage on the community's Facebook page, but given the sheer volume of conversation that's happening on that page and frankly, a lot of misinformation, I, as the town, have been engaging in some of those conversations. I worked with the administrator of that page to post at the very top of the page as an announcement, the most recent information. And so that's been helpful as well. We are working with department staff and staff of the senior center to make sure that we're finding ways to reach seniors and other individuals who may not have access to technology. So for example, our traveling meals program is including a flyer tomorrow with information for people who are in that 75 plus range to let them know how they can access the vaccination sites. We'll also be providing a script to those who are answering the phone within town departments to let them be able to answer sort of basic questions about the vaccine. We've created a dedicated email address as well that people will be able to email their questions. And then I'll just say, this is obviously not a challenge unique to Needham. And so we have a group of public information officers for surrounding towns who have been emailing and meeting. We now meet every week to talk about these issues and share best practices so that, we're not all recreating the wheel. Do I have questions on the sort of vaccine front before I move on to the mask front?
Any board members have questions? No. Okay.
Great. So this has been in the works for a couple of weeks, but like I said, it's a bit more timely given the increase in cases among young people in Needham. So we launched the Needham Mask Challenge this week, which includes a couple of things. So we ordered from Raffinova, the Needham-based mask company, about 2,000 masks, which if I can show you on my screen, have the Needham Needs You mask up logo. And so we're distributing these free to the community. We've sent one to every member of town staff. We've sent 300 out to seniors. We've given another 100 to the community council. We have 100 for the hospital. We have 100 for the general public, just at the fire station where they can pick it up. And then we're working with Amy Halson, who's our economic development manager, to get it out to the local businesses, especially the businesses across from the high school where seniors frequent, the Dunkin' Donuts, the Hungry Coyote, places like that. And so we've also launched a social media video. It's a 30-second video that really hits on this idea. I think what we're hearing is that kids still think that, they're either immune from COVID, or if they get COVID, it's not going to be that big of a deal. And so the video, which I think I can tee up and show you if there's interest, the video focuses on, okay, let's assume for a minute that you're not going to be severely damaged if you get COVID, or you are immune from COVID. Think about all of the loved ones who you may pass it on to who aren't immune, who aren't, who are at higher risk. And so we've worked with the schools on getting that video out through school leadership, so both student leadership and staff and teachers. We're also working with some of these folks that we've given the masks to, like the community council, to have them share the video. And we're really asking people to take a selfie of themselves with their mask on and to answer the question, who do you wear your mask for? Hashtag it, they post it on social media, hashtag it Needham Mask Challenge. So we have some paid advertising on this. So if you're on Instagram or Facebook, you'll probably see the ad. I hope you see the ad many, many times over the next 6 weeks. But we're also trying to make it a town viral video as well. So Tim, I don't know if I have the ability to share my screen or if I have the ability to share the video.
I think you do as a panelist.
Okay.
Whoops, there we go. Maybe now you do.
All right, can everybody see that video right there?
Yes.
So it's a little quick, and I'm not sure, could you hear the volume?
I didn't
No.
hear the volume.
Okay, well, go to the YouTube page, or we put the video on our on the town's website front and center, so you can also watch it there. But you get the gist of it. It's short. I've seen it on my Instagram. Now I'm tired of seeing it. I've seen it so often. But you know, we hope it's just one more tool that we can use to remind people of the importance of wearing their mask, particularly now that we have these variants that, you know, we know are more dangerous or spread more quickly. I think, let me just check my notes here. I think that's the gist of what I wanted to share with you. We continue to work with partners, the business community, to remind people that we're still very much in the thick of COVID and precautions still need to be taken. You know, like I said, I think there's definitely an appetite for information around the vaccine. And as we continue to get information from the state, we will continue to share it. It's, you know, it's very challenging to put out information when it's constantly changing, but, you know, we're doing the best we can. Looks like Steve has a question.
Yes, I'm just wondering if you've distributed masks to the town meeting members as community leaders, as well as to the student leadership at the high school.
So it's a great question. We have not. We have a limited number at this time. I think Tim and I need to have a conversation about whether there's additional resources to order more, because I think it's a great idea.
Thank you.
I'll find the money. And Ed, they might not have started going out to seniors yet. I know the Aging Services Division staff picked them up Tuesday afternoon. So I don't know if they started going out yesterday, or maybe they're going to go out today or tomorrow, but they had a list of people that they were going to try to push them out to, starting with some of the recipients of the lunch programs or the groceries as the start.
Okay. Members of the Council on Aging.
Yes, I do have some for each of the Board of Health members too.
Great. I also wanted to kind of second the idea that I think getting it out to other peers, we know with teens, like peer-to-peer education is kind of so important that I think it would be a good idea if we can engage other groups. You know, we have the connections through SPAN and other groups there.
Yeah, absolutely. I've been working pretty closely with Mary Lammy from the schools on this, and you know, we talked about finding student athletes, members of the student council, sort of a broad cross section of student leaders, so that they can all share it with their groups.
Yeah.
I like the design because it's got a wire, it's got the clips to make it fit. Masks fitting well really needs to be a priority. So I think, I don't know if there's a way to do education on that. I mean, we're starting to tape masks. We're, you know, layering. Mm-hmm. I'm not a huge fan of the, you know, 2 and 3 masks, but you know, a surgical with your fancier one over top can be a look for kids or something. So I like at least the design. I think is a good one, and they hold up.
It's really comfortable too. It's one of the most comfortable ones I've had.
Mm-hmm. Great. Any other comments from board members or any questions? Okay, so I think we can move on to the contact tracing efforts, if that.
Sure, and Tiffany, if you could give an update. I know that as Cindy referenced, we've had a couple of clusters in the schools, which maybe we also want to talk about because it did prompt some school closures and the suspension of athletics.
Sure. So contact tracing has been, I mean, I feel like I say this every time, more and more and more and more, and a little rough. But the last few weeks particularly have been the roughest thus far. As you all know, our numbers kept increasing. Our highest point was 210 or something like that every 2 weeks.
Going on back here.
So, so we've been working through that. A lot of the issues and the concerns we've had is that we can't keep up. We can't keep up with the community. And a lot of times it's been solely focused on the schools. So a lot has gone to the CTC over the last about 3 to 4 weeks. Which we have a good communication with. We have a text rolling going, so it's great. If they have questions, they text us. If we have questions, we text them. So it's actually a great partnership to have with them. 2 weeks ago, correct me if I'm wrong, Tim, the days are all a little mixed for me right now, but about 2 weeks ago, we had a case that popped up in the schools that tested positive or didn't test positive, that lost their taste of smell and things like that, and decided to continue to go to school. And that produced an in-school spread of at least 4 other staff members and 2 students from the same classroom. So we worked with Tim and the schools on that and shut down that. Originally, we first just shut down the 5th grade, and then we ended up shutting down the entire school for the rest of the week to be able to maintain the spread, as some more were involved because some teachers taught different classes or different grades, and some rode the bus and things like that. So, so we did that. We worked through. The schools really picked up a bit on that one because that just got too far out of our control. We couldn't keep up. And then a few days later, we started seeing pop-ups with sports. We had, within 3 days, quarantined 4 sports teams, 2 basketball, 2 hockey, and this week as well. And then an outside party or something that happened. Not sure on the logistics on that and exactly how many, but multiple reasons. And then because 2 people were within their infectious period in school at the time, we then saw an in-school spread to another student that we couldn't connect anywhere else. So the high school was then shut down. First off, because there was a case and we couldn't get the contact tracing done in time for school to open the next day. And then it was shut for the rest of the week, this week. And so still closed till Friday. Polling the numbers as of this week, we will see 178. So we are decreasing as a whole. As of Tuesday, the high school had 29 positive students, and in the 179 cases, or 78, depending on what the state will pull, we had 70 that were student ages. And so the student cases have been a lot, and they have increased tremendously over the last couple weeks. So we're monitoring that and trying to work through a better, more efficient protocol with the high school nurses so that we can try to not only pay attention to the schools, but pay attention to the community as a whole. We have hired 3 contact tracers that will all work evenings and weekends, gratefully, and help Mary. They are all, as of today, officially hired. And then I do believe Mary's got at least 2 of them that she'll be training through this weekend so that we can get them up and running. Although it'll be a couple weeks before they're fully able to get up on Maven and help us with it. But we're very excited about that. They're all very excited to start, which is great. So we're very, very happy and grateful for the assistance they'll give us.
Tiff, it might be just because people might watch from home. Even though case volume is down slightly overall, it has been busier because of school cases. What separates a school case from maybe a middle-aged member of the public?
So a school case, when we get it, we usually get it before it actually comes through Maven. The schools are alerted first because the parents know, and the parents are doing their due diligence and letting the schools know. So then the school nurse calls and says, hey, I just got a mom who called me and said that I got a positive kid. We need to start trace. So then they contact Mary. Mary contacts the family, goes through the regular contact tracing, but also asks, did they ride the bus? Did they play sports? All this kind of stuff. And then Mary goes back and looks at or calls the school and says, I need X, Y, and Z from you to look at seating charts, to look at bus charts, to see what's going on. If they can't definitively give us any of that information, then we quarantine the whole classroom. If they can definitively give us that information, we look through and do the same thing, 6 feet, 15 minutes or more. We talk to each teacher, we go through each thing. Each school trace can take up to 5 to 6 hours to complete, depending on how intricate it is. and then contacting, and then we usually send an email to the parent saying, we believe you're a close contact. This is the protocol. If you have questions, call us back. And then any follow-up we have to do on top of the 5 to 6 hours on that. So it takes quite a bit. And that includes sports exposures, because once it's a high school, we find out it's a Needham student, whether high school or any other grade. And again, we have to go back and do the contact trace, even if they weren't in school. So there's multiple different realms of taking the school on, and having that many cases, and one nurse that can really dedicate, and then 2 nurses that try to dedicate, and then Tim who tries to work on the weekend for us. So we have a break. It's just not quite as doable as we'd like to. So so yeah, so it's quite a bit. And then with the community cases, we try to keep up as much as we can, but again, we have a good partnership with the CTC, so they are very helpful to us, and have used them over the last few weeks.
And I will say, I covered a weekend, and I got to be honest, I forget if it was summer or fall. And it was, comparatively simple. It was a daycare case in an after-school program, wasn't too bad. This past weekend, it was high school and middle school and other cases, and there was sports involved, and there was multiple different classrooms, and there was some confusion over the attendance lists and the seating charts, and then the volume of questions you get back, and the volume of questions where you sent an email saying your child is excluded until this date, and someone writes back, hey, here's their negative test, they're going to be back tomorrow, and you have to be like, no, they can't come back tomorrow. There's a lot of, I have new appreciation for how hard our contact tracers work, and I'm really excited that we are going to have 3 people working about 10 to 15 hours a week to help, which is going to be great because the nurses have to devote a lot more of their time to vaccination, which I think is probably, if it's okay with the chair, we would maybe jump enforcement activities. We'll come back to that, but to talk a little bit about vaccination. As I think folks know, the governor had a very helpful press conference on Monday where he announced that people were going to be eligible for vaccination. Phase 2 was going to start on Monday, February 1st, and people could start signing up. There's a couple important things to understand with that. One is there is very little vaccine anywhere. And as a result, the state has, I think wisely, said you should not schedule vaccine clinics unless you have your vaccine in hand. So when the governor says you can sign up for, getting vaccination, that means of those providers who have vaccine, almost all of whom have very little vaccine, then they will open up slots potentially. In Needham, for example, we haven't gotten any of the vaccine yet for the 75 plus population. We received vaccine on, to me, was it Monday or Tuesday?
Tuesday.
And that was in response to an order we placed 10 or 13 days ago for non-COVID facing healthcare workers. There are clinics scheduled right now for today and for Tuesday with 100 non-COVID facing healthcare workers each day. And we hope to start doing a 75 plus clinic possibly as early as next week. We had been ordering 200 doses a week with the intention to sort of increase that to 400 and then hopefully get to about 1,000 a week by mid to late February. On late Sunday night, the public health DPH emailed Tiffany and I and said, you are capped at 100 doses per week for at least the next 5 weeks maximum. So that complicates our efforts. The governor in his announcement on Monday did reorganize slightly the priority groups within phase 2 so that 75 plus and people with 2 or more comorbidities are still at the top. He moved 65 plus above the sort of other category, which is critical workers, which includes a very significant portion of the population. It includes grocery store, restaurant workers, includes teachers and school staff. It includes public utilities, public works, that sort of thing. I think it's a little bit challenging, but that's a good thing from our perspective, if for no other reason than there are 900 teachers and school staff in the Needham public schools, and at 100 doses a week, it will be quite challenging to vaccinate them. We did on Monday also receive our ultra cold vaccine freezer, which can hold our Pfizer BioNTech vaccine. So Tiffany's been setting that up and learning how to use it. We did email the state sort of right away saying, hey, you said there was a cap on Moderna, but by the way, we can take Pfizer. We'd love to take more. And they were nice but non-committal in saying, that's great. We're very hopeful that we do get the 100. I think the concern we have still is the state had been assuring us Thursday, Friday, even Saturday that, you know, if things were going as planned, we were going to get vaccine, we were going to get more vaccine, it was going to ramp up. And then sometime Sunday afternoon, evening, night, email came in, I think at like 10:30 on Sunday night, they changed the plan. So I think that creates a lot of confusion. Cindy referenced the focus on getting sort of a script and an FAQ. A lot of town departments got a lot of calls. I think Tuesday morning between open and lunch, the center at the Heights had gotten more than 100 calls. We'd gotten a couple dozen calls and a lot of emails. And I don't know, when I was here Tuesday night, after most folks had gone home, I got 4 or 5 people who just drove up and knocked on the door trying to get vaccine. The interest is very high, and unfortunately the supplies are not there. And that's frustrating for everyone involved.
We've had multiple walk-ins yesterday too, since it was the first day that those 75 plus were be able to sign up. And unfortunately, a lot of them brought their laptops with them and said, please sign me up. And we're not able to do it that way. So today we're anticipating the same, but we're also holding our clinic starting at 9 o'clock. So we have written up some papers that we will hand out that basically say, we can't do this here, but sign up. And here's the step-by-step list of how you do to find a clinic. And here's the process to go to get an appointment. While at the same time, also urging people to look at other sites because you won't get it on the first try in Needham. We attempted to open a wait list with our clinics today and Tuesday so that people could sign up on that. The wait list quickly went to 1,000 people on Tuesday and 800 today. So we shut down the wait list. And another thing I think we need to work on campaigning, because I've been getting a lot of, is when you go into PrepMod, and I have no control over PrepMod as it is a state-run system, is that you can still go in and put all your information into that system and then get to the very last page where you pick your appointment and there's 0 appointments. And that's frustrating people. So I think we need to focus on that too and say, if it shows 0 appointments, do not go in and try to sign up for one, because you'll have to enter all your information. And it's not like it keeps your information so that you can then just go find another appointment. It deletes it all and you have to re-enter it each time. So those are a few key things we've learned over the last couple of days. And then
that's a message, in fact, that we should probably be telling the state. I mean, the governor's getting a ton of flack over the rollout and says this is so easy to do. The scheduling of the appointment should be first, confirming the appointment prior to inputting all of the insurance information. I went through this with my parents yesterday, so I'm familiar with the site, and it truly is a disaster. I mean, the governor might not admit it, but it needs great improvement, and he should be hearing that from the cities and towns directly on behalf of our citizens.
Yeah, I tried it yesterday too. It's a disaster.
Yeah, we put it in through PrepMod. We have the ability to ask questions, but as many of you know, we've been talking about this PrepMod since August, and it never rolled out, and never rolled out, and never rolled out. And what they keep telling us is that there's some drama with licensing agreements and what they can adjust and what they can't adjust. And because it's a state-run thing, the state has to adjust certain things and they can't allow the locals to adjust others. So working it through, but yes, they're aware of all our concerns. And I also asked the resident who talked to me yesterday to also please pass on their concerns. And I gave them the technical support email so that maybe that could also help as well to try to get words out in multiple different ways.
I think it's
Are we
fairly common for systems just for identity protection to not retain the data you entered, including like birth date, address, health insurance information. What is sort of inexplicable is you have to enter all of that and go through multiple pages before you can then pick an appointment. That just, someone didn't do a good process map when they were trying to think of how this was going to work. That's inexplicable.
I was just going to ask are we offering any support to older folks who need help signing up or, kind of technical assistance?
Yeah, so the social workers are having a training on Friday with the Council on Aging National or State Association to learn and navigate the site, to be able to understand how to help people sign up. And then they have sent out some volunteers with the awesome help of Talib to get some people to help Mondays, Thursdays, Fridays, Mondays, Wednesday. I'm not sure which days, but a couple days a week for a couple volunteers to be able to then help people navigate, try to figure it out. We are also working on a form that will have step-by-step instructions with pictures of what's going to look like. So this is how you do it. This is where you go. This is your next step. This is your next step. And then Stacy at the Council on Aging has also created a video, and she just videoed herself doing it so that people can see how you enter in your information. So we're trying to push out all of those things as soon as they're finished so that we can really get some good word out there. So yeah, things are going. It's just things got rolled out before the ability to be able to keep up.
Yeah. How are you going to push that information out on the
Well,
town website?
Yeah, I definitely website, definitely any kind of in the updates and things like that. I think the Center at the Heights may have or is going to put it in their daily update today or yesterday. I'm not sure if they've done it yet. The video at least. And then we also have stood up a Needham vaccine at needhamma.gov email.
So
that will also be pushed out so that people can do that. And then we can kind of triage the questions to who they appropriately need to go to from there.
Okay.
I think we need to be transparent about how little vaccine we have.
Mhm.
You know, people are really, as we know from the numbers, like if you've already got almost 2,000 people on the waiting list, there is a lot of interest. But I think people need to understand that we want to do this and we're trying to do this the best way we can, but we don't have vaccine. I mean, 100 doses a week for the next 5 weeks, you know, that wouldn't even get us a quarter of the way through the waiting list.
So Robert, we have actually, we have pushed out as a totally separate message, and it's on the top of our website, that we've been told we will have 100 doses per week to set expectations for the community that that's all we have. And we'll continue to reinforce that.
And people have been very good when we explain it too. Like, I understand that you want it and I'm so happy that you do, but I can't provide it. So continue to look at other places, continue to look at this map and find other places that are there and available to get to as well. We also will, I just lost my train of thought. Little early.
But I do want to continue actually the vaccine discussion, but I know that Steve is working clinically. This isn't just a fashion choice. So I was hoping we could briefly, in the minute or two before he has to go, jump to something the board didn't get to see until last night, and I'm sorry for that. It did take a while working with the new town council, Chris Heap, and with Cheryl Savara's input. The town has been approached by TripAdvisor and Newton Wellesley Hospital, who are interested in opening a relatively high volume clinic on the first floor of TripAdvisor. Relatively high volume, not 5,000 a day like Gillette or Fenway, but they're thinking 600 a day.
600, yeah.
In speaking with them, I was slightly saddened and slightly heartened to hear that they don't have any real vaccine for that clinic either. They're hoping that if they get it set up, the state will follow through and give them vaccine. I think we're hoping the same thing. But I think there's real value in trying to figure out for Needham residents how we can get as many options available in a relatively close geographic area. I'll bring her on, and I didn't actually ask her necessarily to speak, so I don't know if she's available to speak, but Lee Newman is the town's director of planning and community development, and I just promoted her to panelist. She's been listening in. There is TripAdvisor obviously is not particularly highly used, their headquarters right now. A lot of their staff is remote. They have very large parking lots, and there's not a ton of people in the New England Business Center. To me, it makes a lot of sense as a potential location to have a clinic. I think there are some challenges with the way the state is pursuing vaccination. I think it's challenging to ask a 82-year-old to drive to Gillette Stadium. Even if everything is well set up at Gillette Stadium, it's still a long walk from the closest parking spot to get in. I love the idea of trying to do things closer to home. I love the idea of Needham Public Health doing those vaccinations, but My main priority, I think the public health division's priority, and I think I can speak for the board and say its top priority is to get as many people vaccinated in as efficient and quick a manner as possible. It doesn't really matter who the person is who's sticking it in someone's arm. In that vein, when the town was approached by TripAdvisor Newton Wellesley Hospital, Lee and her team were consulted, as was Building Commissioner Dave Roach. There is very express restrictions in the town zoning that prohibit a sort of, I don't know if it's a medical clinic or sort of any type of medical use in the New England Business Center. Part of the reason that there was so many zoning articles at the last town meeting, or I guess maybe spring town meeting before that rather, so like June of last year, was the Children's Hospital outpatient centers had to essentially have whole new zoning wrapped around them because they were doing a use that the town had originally not envisioned in the New England Business Center. In talking with Cheryl Sabara and talking with Town Council Chris Heap, as well as the town manager talked extensively with Lee, the planning board, and Building Commissioner Dave Roach. They feel that the Board of Health's essentially emergency powers under Mass General Law, Chapter 111, allow the board to, for lack of a better word, and it's displayed in the document, to dictate that certain zoning provisions are not enforced for a period of time to correspond with the public health emergency, so that a public health good like vaccinating the public can proceed as quickly as possible. So the request I'm making to the board is whether they would consider approving an emergency order as drafted in the packet that would essentially say to Lee Newman, Building Commissioner Dave Roach, and others that this part of the zoning is not something that you can or should enforce for the duration of the public health emergency, because we really need to get people vaccinated, and that's for the preservation of the public health. That is our top priority.
Absolutely.
I kind of thought it was a no-brainer. Again, I will continue to push, and I want the board to continue to push, and I'm going to have the town manager continue to push for Needham Public Health to get more vaccines, because, you know, having a clinic at TripAdvisor is a great thing, but TripAdvisor and Newton Wellesley Hospital are not going out to the Needham Public Health Authority. They're not going and making house calls to our traveling meals recipients. There's a lot of need in the community, but this will help to address some of that need.
Yeah, I don't know if I'm not on mute. I just want to make sure that, you know, our residents actually have access to this. I mean, this, you know, it's not a private, you know, facility only for their employees. This is open to the public, and in particular to our residents.
Yes, that's one of the, that is one of the requirements. I'm sure they're going to want to push it out to their
Understandably,
but
sure. I mean, they're going to want to be eligible as they are, you know, per the state. But, you know, some of these are restricted to, you know, some clinics are restricted to town only, which is one option for Needham, obviously. Right now, we're listed as a general site open to residents of any community.
Yep.
But a number of communities are restricting their vaccines to community members only. So if we're going to authorize the opening of this site, I just want to make sure this is open to the public.
I will confirm that, but that is my understanding based on discussions with their government relations person and their proposed medical director.
Okay, thank you.
So before Dr. Eckstein has to go, is it possible for the board to consider having a vote on this item unless there's more discussion?
So moved.
Second.
I'll call the names, all those in favor. So Ed Cosgrove,
Yes.
Rob Partridge,
Yes.
Steve Epstein,
Yes.
Christina Matthews,
Yes.
Kathleen, yes. So the ayes have it.
Thank you.
Thanks, Tim. Yeah, I agree. The plan for, you know, kind of following the governor's model, set up the sites and hope the vaccine comes is so.
Well, that's what's so frustrating about the sign up through the state.gov website is we heard it already. You go through it, and then they say there's your first appointment is March 31st, and then you just say forget it.
So real fast, I get off and go start getting the clinic set up. But Kristen Scoble just let us know that Gillette has thousands of appointments open for next week. So if you push that to people, you know, we will try to make people aware of that as well. And yeah, good to see everyone.
I think though that for older people, the Gillette option is tough. I have some friends that have done that, and especially if you have an appointment late in the day, you end up waiting outside in the cold in a long line. And I think maybe younger first responders can do that, but I think that is harder for older people,
It
especially.
definitely is, but it's good to let them know so that
Yes, no, I totally agree. It's just frustrating for me that seems to be the only option with a lot of vaccine available.
yeah, we've
Correct. My 77-year-old parents just texted me that they got appointments at Gillette on Saturday when the temperature is supposed to be 3 degrees. They're saying that people can wait in their cars. I don't know how viable that actually is, but yeah, a lot of people in their 80s waiting outside for hours is going to result in hypothermia. And I hope that the state is ready for that possibility, because that's going to be a big stain on them when that happens.
Yeah, I mean, I like Kathleen said, I think you have to build the infrastructure, and ideally the vaccine would arrive right as you've built the infrastructure, and it's clearly that's not the case. There's a gap. There is a role for high volume sites, even though I am quite sore about it. There is a role for commercial pharmacies to vaccinate. I don't think it's as important as local public health, but it has to be an all, not an either or. It has to be an and this and that in order to sort of reach all the groups we need. So we're going to continue to push. We've talked to our state legislators. We've talked to, I've made some calls to my old friends at DPH. Tiffany and I have a call this afternoon with the Assistant Commissioner of Public Health at DPH, Jenna Ferguson. I don't know if the board saw, there was a Globe article that was comparatively critical because she was the one who gave us the news about the 100 doses restriction. I will say I've worked with her before, and I think she's very talented. I think she cares a lot about local public health, and I think she's carrying water for people higher up the food chain. I know for a fact, or at least, well, not revealing who told me at the state, a couple of people told me at the state that the only reason local public health got any was she fought for the very small allotment of the pie that local public health is getting.
Right. The only issue with that, Tim, to some degree, and particularly, when we talk about opening another clinic, is that right now, one of the problems that people are having signing up is there are many sites, and those sites have very few appointments. So it is very frustrating for the public to need to make multiple calls or multiple attempts to multiple sites trying to find the vaccine. Yep. Frankly, it's easier for them to have a well-run regional center where, if you don't get an appointment there just isn't an appointment to have, because that's where all the vaccine is. So, when we talk about opening up the TripAdvisor site, which I think is a great thing, ideally that means more vaccine. If that's a way to get more vaccine in our local area, that's fantastic. If it doesn't get more vaccine, but just makes it harder for people because now they have to check an extra site, that really doesn't do anybody any favors.
I hear you. Absolutely.
Agreed. Yeah.
I don't know if the board wants to jump back to any of the things about vaccine allocation or talk a little bit with Tara about COVID enforcement, which thankfully is maybe not quite as prominent an issue as it has been in past months, but is still, I think, our most frequent complaint. I think that's safe to say, Tara.
Yeah, we're still right. It hasn't been as bad as it was. So the mask ordinance, I think with this extra mask publication that Cindy's doing is going to help dramatically. So we're not seeing the spike in numbers of complaints that we've gotten in the past. So it is a lot better.
And we have, with a notable exception that you and I are going to continue to talk about, we haven't found too many complaints about some of our frequent flyers who had gotten complaints earlier, whether that means they've started complying more or they've gotten better about not complying while people are around, wisened up. I can't say for sure, but I think the effect is that they're wearing their masks when people are around more often, and that's what we're hoping for.
Maybe they got the message it hurts business, if people aren't going to walk into a place. It's interesting. And then the governor's, some of the restrictions on dining may lift in a week, right? The 8th.
Yep. I think that's that's certainly a question the board could consider. Needham's case numbers are going down slightly. As Tiffany mentioned, there has been a spike in cases amongst youth. And I think, so I did include a packet of data in the Board of Health packet I sent last night, just sort of looking at Needham that we do each week in the context of some of our surrounding communities and other counties, the nearby counties, looking at both the average daily incident rate and the percent positive rate over a 2-week period and the trend. And then thanks to Hannah Whitehead, our part-time epi, we do have, I think, much more visually attractive charts than I was producing very early in the pandemic. And then Tiffany helped me produce slightly more visually attractive charts. And now we actually, I think, have visually attractive charts. So I think if there are particular ways the board has, they'd like a view that looks like this, or they'd really like us to dive into that, we're definitely looking for that sort of feedback from the board. But you can see that information in your packet. So I don't know if the board has questions about that. This is based on the state data that was released last Thursday. The state's going to release new data this evening at 5-ish p.m. They say by 5 p.m. every day and they never make it.
So I think it's a comment that Steve's made and I've made previously, but population adjusted numbers would be helpful. So when we see the number of cases in the 5 to 18, how many people are in that group versus over 65? I think it's about the same as the over 65, but still to population adjusted would be great. And I'm sure she's able to do that. So that's great.
Yep.
Okay.
With regard to transmission in schools,
Yes.
do we have any sense as to whether this is related to not following proper procedures to mitigate the spread, or is it more related to students who are coming to school when they, as we heard before, know they may have viral symptoms and they're continuing to go to school?
I think the case Tiffany was referencing earlier was a staff member, which is very not thrilling. I did talk to one or two of the board members, and I have investigated alternatives. Cheryl Sabar and I spoke. The board does have the option essentially to find someone who does something like that. I think there's, there can be some question about if the person fully knew that they were sick. I think it's potentially hard to prove, but if a person knowingly, if we had quarantined someone and they had come in, so she had not yet been told she was sick, I think she should have reached the conclusion based on her symptoms and the fact that they persisted for multiple days. But if a person knowingly broke quarantine, the board certainly has the option to fine them under its nuisance, the state nuisance law, which would be $1,000 fine, which obviously would hurt a little bit for some people. So I think that's potentially an option in the future. Generally, we've had pretty good compliance with people following our quarantine. There's been some people who've been more reluctant and we've had to sort of not be as gentle with, but this is an option that's in our back pocket. Cheryl gave me a draft. I have it ready if we did ever need to deploy it.
I would be reluctant to employ it, but I think if you have somebody who's recalcitrant, definitely it should be employed.
Absolutely.
I mean, so one of the questions here in the schools was, whether or not others knew of this person's symptoms and didn't report it.
Yes, and I've been trying to get an answer from that, and I don't know. I don't know if the schools have gotten an answer on that. I think more people should have known. Is the sort of obvious conclusion. Yeah, I think it's a very frustrating situation. The high school, as Tiffany referenced, was actually a case of sort of the SUNY Williams School was a case of in-school transmission based on the actions of one person that were unfortunate in that spread. The high school situation, unfortunately, was kind of a perfect confluence of one person was sitting approximately 5.5 feet away from a person behind them and a person in front of them, both of whom were in school with active COVID and didn't know it. We've never sort of encountered that before. It's somewhat just dumb bad luck that both of the people who had active COVID were in that class and surrounding that one person, but that is our understanding of how the transmission occurred.
Tim, how does all of this impact Dr. Gutenkantz's thoughts on bringing the younger kids back? Have you had discussions about that?
Yes, Dan and I talk very frequently. The school is still hoping to proceed. The superintendent on Tuesday night at the school committee meeting introduced his plan or presented his plan to school committee for a staff testing program. The costs projected at about $340 something thousand, not including time of a part-time staff member or two to help administer and run the program. So probably something on the order of $400,000 costs to do weekly pool surveillance testing. The hope is, that with that in place, the plan would be to bring back all students K-2 4 days a week. So it'd still have a remote Wednesday, but 4 days a week every week. And to add some additional synchronous learning for 3 to 5. So additional sort of live teaching time via Zoom for the 3 to 5 year olds each week, 3rd grade to 5th grade, not 3 to 5 year olds. That's the proposal. I actually did not, I was on select board. I didn't go to school committee virtually on Tuesday night. I don't know how they received it. Dan doesn't really develop things in a vacuum, so I'm sure that he had been getting their input all along. Kathleen, did you?
Yeah, I attended, or watched. And yeah, they did approve, going forward with this testing of the staff. Still discussions, other ideas are still floating out there on other testing, possibly including kids and things. But again, with a $400,000 cost, multiplying that by 5 to 6 would be difficult. So, but I know not anything is off the table as far as I understand.
I know our goal was to keep this meeting to an hour or less. I certainly think COVID is our primary topic. I did include at the back of the packet 2 letters that the board generally votes to approve and send every January. One is a designation of agent. The board has the power in Massachusetts general law to designate, sort of vest its power in a director or a health agent. Historically, the board has invested that power in me, and then also I can sort of deputize anyone with the board's power I want, but the board has chosen, and I think rightly so, to deputize Tara as the assistant public health director. With the reorganization, I would propose also having Tiffany be sort of the deputy agent. So Tara maybe is the first deputy agent, Tiffany is the second deputy agent. The other is, and I think the board is familiar with, just sort of a charge every year that we should follow the science and we should not be afraid to tell the town meeting members, the media, other boards, the health implications of policy choices and programs. I think this is partially a paper shield, but I think it's a shield nonetheless. If there's ever sort of criticism of the position that the division is taking and saying you're politicizing something, I think our goal is never to politicize something. Our goal is to bring the facts to bear and certainly to probably educate and maybe even advocate against anything that does jeopardize the public health.
I move that we approve both of those letters. We've done that before, so.
Second.
Those in favor, Christina,
Yes.
Ed,
Yes.
Rob?
Yes.
I think Steve is absent, but and Kathleen, yes. So the ayes have it. We'll accept both letters. Correct. Okay. I'll go back to are there any other items of business on, actually that appears to be the whole agenda unless there's anything else anyone wanted to bring up. Dare we finish early?
I guess just as a reminder, so we're going to continue, I think, with this plan. So I will follow up with the board. The next regular board meeting is scheduled for Friday, February 12th at 9 a.m. via Zoom. And that's not going to quite be a 2-hour meeting, but that's going to hopefully be an hour and a half, which will cover sort of more day-to-day topics, but still include a briefer than today section on COVID. We haven't yet set a second meeting in the month of February. The board, I think, was hoping to sort of do a roughly regular meeting on the second week, maybe the brief meeting on the fourth week. So essentially meeting roughly every 2 weeks. I don't know if the board would want me to maybe schedule it, send out a doodle just to see, what the availability looks like at the end of February.
Good idea.
I think that 9 a.m. slot on Friday, we all try to do the Mass DPH webinar if we can. So I'd prefer not to overlap with that. But other than that, I think, yeah, that would be great.
Sure.
Yeah, terrific. Thank you, Anne.
And do we have for our regular March meeting, do we have a date for that?
We do not yet.
Okay.
Do you want to put both of those in the, let's just go 2 months. And so 4 meetings, do a doodle poll. Everybody can put in what works for them. Does that make sense?
Okay, so we'll do a COVID brief meeting, and I'll do a doodle poll for roughly the end of February. And then we'll do a doodle poll to get the regular sort of March meeting, which would probably be in the first 2 weeks, and the COVID meeting, which would be at the end of the month.
Yeah.
Yep.
Sounds good. Okay. Okay, so we will adjourn the meeting, I believe. Have a motion to adjourn.
So moved.
I'll second.
Tim, can I call you on?
Yes, please do.
Okay.
Okay, great.
Yeah.
Thanks, everyone. Thanks for the quick
Thank you.
update. Okay,
Yes, thank you.
take care. Bye.
Bye.